Welcome to your Birth Choices webinar. This is a brief session provided by the Birth Choices midwives at Surrey and Sussex NHS Healthcare Trust, also known as SASH. The aim of the session is to share current information to help you to start thinking about your choices for birth. These will be discussed in a future appointment in your pregnancy, but you may like to start looking at your options early on. We recognise that you each have individual circumstances that will influence your choices, and we aim to support you with this during your pregnancy. Please keep your phone nearby, as we will provide a number of QR codes for you to scan throughout the course. Who is this session for? You may be attending this session because you've had a previous cesarean birth, or perhaps you're considering a planned cesarean birth this time, or because you've had a previous traumatic birth and wish to explore your birth choices further. Following on from your initial booking appointment with your community midwife, you may now be referred to other members of the maternity team to support you in your pregnancy journey. You have been referred to the Birth Choices services due to your individual circumstances and will have an opportunity to discuss your preferences for birth in more detail, either with a Birth Choices midwife or with your consultant obstetrician. You will, of course, still have continued support of your community midwife throughout your pregnancy. As well as speaking to healthcare professionals about your choices, we would recommend that you explore your own thoughts and feelings with your birth partner in order to make the best choices for you and for your family. Let's look at the numbers. When we look at the local and national statistics for SASH, we can see that we are comparable to the rest of the UK. Nearly half of babies born are birthed without assistance. A third of our babies are born via cesarean, and fewer than 13 babies per 100 require assisted birth via forceps or ventouse. You can take a look at our social media pages to keep up to date with what has been happening in our unit. Our annual dashboard for 2024 will show you how many babies were born at SASH, including where the babies were born and other interesting facts. We also release monthly dashboards so you can keep up to date with what has been happening in our maternity unit each month. A number of you listening to this webinar might be considering planning a vaginal birth after having had at least one cesarean. This is known as a VBAC, vaginal birth after cesarean. If you have had one previous cesarean and no vaginal birth, your chances of a successful VBAC is around 3 in 4, or 75%. If you have had one previous cesarean and one previous vaginal birth, this increases the likelihood of a VBAC to almost 9 in 10, or 90%. A number of risk factors make the chances of a successful VBAC less likely. For example, if you have never had a vaginal birth, if you did not make progress in labour and needed a cesarean birth, if you are overweight with a BMI of 30 or over at booking, or if your labour is induced. In these circumstances, successful VBAC is around 40%. We are now going to look at some of the risks and benefits of both vaginal birth and caesarean birth. Some of the risks of vaginal birth include increased need or want for pain relief, potential vaginal trauma which may need a repair. There may be a need for assistance with a ventouse or a forceps, or you may need a caesarean section. However, some of the benefits include a quicker recovery, a shorter stay in hospital, less pain following birth, higher breastfeeding success rates, and a greater chance of an uncomplicated birth in the future. Remember, for most women planning a VBAC, the success rate is about 3 out of 4 women. Let's see how that compares to the risks and the benefits of a planned caesarean birth. Some of the risks of a planned caesarean birth include increased likelihood of post-birth pain, a longer recovery and return to usual physical activity and driving, increased risk of developing scar tissue, an increased chance of developing an infection, and you may still go into labour before your planned caesarean date. There's a small risk of a cut to the baby during a caesarean, a longer stay in hospital, surgical complications, and increased risks of DVTs or blood clots. Alternatively, some of the benefits of a planned caesarean include the chances of requiring an emergency caesarean birth or assisted birth are minimised, avoiding vaginal trauma, and a planned date of birth which may reduce uncertainty. Taking extra care of your physical and emotional well-being during your pregnancy can help to optimise your chance of a positive birth and recovery. Eating a healthy, balanced diet will help your baby develop and grow. There is no need to eat for two. That is a myth. You can use the Eat Well guide via the QR code or via the NHS website to help make balanced choices. A raised BMI increases your risk of developing diabetes in pregnancy. It may exacerbate existing medical conditions, affect your chances of a successful vaginal birth, and can cause delayed recovery during your postnatal period. The more active you are during your pregnancy, the easier it will be to adapt to your body changing. It can also help you cope with labour and get back into shape after birth. If you were not active before pregnancy, do not take up strenuous activity. Instead, begin gently with 15 minutes of continuous exercise 3 times a week. Then slowly increase this to 30-minute sessions daily, doing sessions such as walking or swimming. If you take exercise classes, make sure that your instructor knows that you are pregnant so the exercises can be adapted for you. Being pregnant can be emotionally demanding too. Be kind to yourself. Take time to check in how you are feeling and find relaxation techniques that work for you by exploring exercise or meditation. You may wish to include your birth partner in this. Mindfulness or relaxation techniques will be useful during the birth. There is further information on your emotional well-being during and after pregnancy available on our maternity website at surreyandsussex.nhs.uk, along with lots of other information to support you throughout your pregnancy journey. If you have any questions about this, your community midwife will be happy to discuss this with you. Please take some time to scan the QR codes on your screen. What's next? Most importantly of all, enjoy your pregnancy. Spend time exploring your thoughts and feelings on your personal birth preferences. Think about what is important to you and what can help. You can use the brain tool, which can be found in your notes. Later in pregnancy, you can write down your preferences. You can find a page especially for this in your antenatal notes, which your midwife will talk to you about. Remember, every pregnancy is unique, and at each context, there might be new factors that alter the course of your journey. You should always feel informed and have an opportunity to discuss this and to make informed decisions on what happens next. Your midwife and obstetrician can help you in this. Our goal is the same as yours: healthy mums and healthy babies. Here is an example of the brain tool. If you haven't seen this before, it is a great way to make sure that you understand any information that you are given and are able to make an informed choice. B is for benefits. What are the benefits of this test or procedure for me or my baby? R is for risks. What are the risks of this test or procedure for me and my baby? A is for alternatives. What are the alternatives to this test or procedure? I is for instincts. What do I think? What feels right about it? Is there someone else I can ask? And N is for nothing. What might happen if I choose to do nothing or decide to wait and see? Thank you for listening to this webinar. You can find additional courses via our Eventbrite page and via our website using this QR code. We have provided links to the latest national resources to provide you with more in-depth information to read in your own time. Please take some time to scan the QR codes now. These are also available in your antenatal notes or on the SASH website. If that wasn't enough information, don't forget you can look in your maternity notes for even more. Any page with a pink triangle has information for you, as well as the patient information section in the back part of the notes. You can look at the wealth of information and videos on our SASH maternity webpage. Follow us on our social media pages and look out for the My Choices for Pregnancy, Birth and Beyond booklet, which can also be found on our website. Finally, take some time to scan the following QR codes for even more fantastic pregnancy information. We hope that you enjoyed the session. If you have any questions, please do not hesitate to talk with your midwife. And as always, if you have any urgent concerns, call our 24-hour triage line.